So Liam, notifiable infections. What is a notifiable infection and why are some infections notifiable?
In WA there are 82 notifiable infections.
Okay.
These are prescribed by law and the law states that these must be notified to the communicable diseases section of the health department within a certain time frame.
And now why are some of these diseases notifiable?
It's because they have the potential to impact on the community by producing outbreaks or even epidemics, and importantly these outbreaks can sometimes be prevented or ameliorated by taking action like locating a common source, quarantining the patients or giving prophylactic antibiotics or vaccinations to contacts.
I understand. Okay. So I have here, and I'm going to show the students, a copy of the Western Australian Health Department notification form, and the students will have one of these in their folders now during this tutorial. Look, I can see that some of the infections there look like they require urgent notification. What's going on there?
Okay, 32 of these infections have a little telephone symbol next to them, and that means that the 72 hours, which is the contact time for most of them, is too long, and they have to be notified by phone within 24 hours. However, there are some infections on there where you wouldn't be waiting for 24 hours, but you would be calling immediately that you had a suspicion or confirmation.
Like what kinds of infections would that be?
Well, a good one, and something that's very topical at the moment, is measles.
I know we had a notifications going around a couple of weeks ago.
Yes.
Yes.
Measles is a problem at the moment, and something like Ebola.
Oh, right.
Deal with that immediately.
So fever in a return traveller who meets the case definition for Ebola and has an appropriate travel history to an endemic country.
Yeah, that's right.
Okay. So what does the lab do? Once the lab has found a notifiable disease, what do they do?
Well, let's take an example of the lab I work in, PathWest, which is the Public Health Reference Lab.
And let's take the example of the student, in this case, Dave, who after 48 hours, the samples taken in emergency have returned a positive stool culture for Campylobacter.
Okay, well that result would be sent back to the GP, of course, the requesting doctor. Campylobacter itself may or may not get a phone call from the lab to the doctor.
Okay. So you down in the lab, who are checking the results, would call the requesting doctor in ED who saw this patient, let them know?
Certainly if it was within the hospital, it would be phoned.
Yes.
If it had come in from a private lab, probably no phone call, but the result would go out pretty quickly to the private lab.
Okay.
Something like measles would certainly be phoned to the requesting doctor pretty quickly.
Okay, so we've told the requesting doctor in ED that their patient of 2 days ago has now got Campylobacter. What does that requesting doctor have to do?
That requesting doctor would need to let the health department know.
Okay.
It's likely that they would follow up with the patient as well.
Right.
But the laboratory is also required by law to notify the health department.
So let's talk about what the doctor's doing with the patient. Does the ED doctor now contact Dave to let him know that this has come through?
He probably would. Yeah, it's a little different when it's an emergency department situation compared to, say, a general practitioner.
Sure.
But I suspect the emergency doctor would contact the patient to let them know.
Okay.
And if the patient was still unwell, they would be advised to go to their GP.
Or back to ED if they were markedly unwell.
Yes.
And I suppose that's so that they can be given antibiotics if antibiotics are indicated, but also so the patient can try and take some measures to control the spread to other people?
Yes. Certain patients are, of course, at greater risk of doing that, like food handlers.
Yes, yes.
And the law specifies certain things for them as well.
Okay, as in time periods before they can go back to work.
Yes.
And things like that.
Yes,
okay.
exactly.
So what's the health department going to do with Dave results?
The health department will interview Dave.
Yeah.
And they will try and determine the source of the infection.
Okay.
It would be a food source, and they want to know if it was something prepared at home or, importantly, at a restaurant or takeaway location.
Okay. So, and that's, I suppose, so if they can see clusters of the disease. So, for example, if on that weekend they got 10 notifications from Netherlands of Campylobacter, what's the health department do then?
Well, they would interview those patients, and it's very likely they would find a common source. They would then send someone out to visit that source, takeaway place or restaurant, and find out why it was happening.
Okay.
Stop it from happening.
Stop the measures happening again. Okay. So from Dave's point of view, his role now really is to focus on getting better, see his GP if he's not, let his housemates know and his student colleagues know, and then chalk one up to experience. Is that right?
Yeah, that's right.
Okay, good. Thanks a lot for that, William. That's great.
My pleasure.